Yeah, so a lot of people want to know, is it safe to come to see your dentist now that the pandemic's, well, we're getting a little bit of it in the rearview mirror, but unequivocally the answer is yes. We were pretty fortunate in dentistry. A lot of the personal protective equipment that were not routinely used by other healthcare workers have been used by dentistry for decades. So we screen patients as we make their appointments, then we screen them when they come again. So the day that they come for their appointments, they're going to be screened for temperature, they're going to be screened for symptoms before we even start the procedure. So that could be another stopping place if we need to reschedule a patient's appointment. In the dental environment, we've done a lot of things to do everything that we can to have strategies to keep from transmitting COVID. So I already mentioned about all the PPE we did before. That's the personal protective equipment. The one thing that's probably new to dentistry being used on a regular basis is special types of respirators. These are the masks most people have seen the comments about on television the last 6 or 8 months about N95s or better that have high filtration. That's a routine part of dentistry when we're doing procedures that create an aerosol. So you've been to the dentist before, they have hand pieces, they have a water spray, several instruments like that. For dentistry, the dentist, the hygienist, the assistant, anybody that's involved in patient care, that now has become a standard for what we do. We've also had some new inventions. One that we use here is called an ISO-Vac or ISO-Lite, which is basically a mouth prop that has suction that's built into it, or another device that actually can hook on to a high volume evacuator while the operator's working. The last step is we have at any dentist office four-handed dentistry. So you have a chair-side assistant, they have high volume evacuation. So that's evacuating any potential contaminated aerosols from the environment. Interestingly enough, there's been a number of publications that have come out just in the last few months that show the main aerosol contamination is what's actually coming out of the handpiece. So in our environment, all of our handpieces are connected to sterile water supplies that are changed on a routine basis. So we've not been able to document any contaminated aerosol that's going to go out of the immediate field where it's being worked. And then we take a lot of special precautions at the end of the appointment. How do we disinfect, clean up the room? A lot of thoughts being given now to like touchless types of environments. So, before where patients might register using an iPad or some device like that, well, they might not do that now. It's something that they don't have to touch, or we have some very stringent ways that these are disinfected. So the key word from where I've been is the word mitigation. I didn't want to use that one to start with when I talked about this, but it's all these layers that make it a safe environment. Fortunately, in the last 60 days, the vaccination rate going up, the infection rate going down, and the San Antonio area, 1.3% or less for like about the last 8 weeks. That's really where we want to be. I think it has a lot to do with the number of people that are vaccinated. So we feel really dentistry is pretty much back to where it was. Probably the caveats are all these things I talked to you about that will now become a standard part of dental care, whether we have COVID or not have COVID.